So, where will we be in 5 years? Many of us think that precision, personalized medicine will be actually the reality. And so that the future truly is personalized medicine. It's not a hype, it's going to become a reality, a daily basis. The future and the vision is that instead of having a few people benefiting from a diagnostic test and a treatment, we're going to select those patients ahead of time and give the right treatment to the right person. For the time being, we have a fairly pathetic average of up to 75 people who are given a drug and not necessarily responding, because we give exactly the same drug to everyone irrespective of their likelihood to respond. However, a couple years ago, and again based on some of the data that I've shown in the previous talk, some failed trials have become positive trials. Here, this is an example of a trial where patients received a drug, and when the entire patient population was analyzed, it didn't succeed. It was not successful. Now, the researchers went back to the tumors, deciphered the genetics, and showed that in patients who had a specific mutation, and with the next generation sequencing technology that we have alluded previously, these patients actually did benefit from the trial, and that basically the future will not be failed trials and where it's going to be one size fits all, but one size will fit the one that respond. And so that probably in the era of personalized medicine, we should pay much more attention to details and to the exception rather than having everything treated in the same way. Now, is this something which is reasonable? Isn't it too costly? Actually, the price of these precision medicine is really nosediving, and we probably are looking for something close to $1,000 even with the most sophisticated tests. And several centers now in Canada are already offering that. The tumors are teased out genetically, they are profiled, they are genotyped. Drugs are selected based on the mutation profile, and the treatments are really tailored in a personalized fashion. And the paradigm is that the patient comes into the office, the tumor is resected, the tumor is analyzed, it goes back to the patient and the physician who will choose the right approach. Now, we showed how complex things are, and the future of the personalized medicine will be even more complex. Not only will look at one mutation, two mutation, but will understand how one mutation can be undermined by other type of pathways. In other words, tumor cells are very complex animals. There's a lot of redundancy. And with all the advances that we have accrued over these years, not only will be able to pinpoint the mutation and the drugs that can work, but also the drug that might not work, so that patients ultimately in 5 years from now will receive either the right drug or the right combination of drugs.